Hi guys. Hello, welcome to the chat. Um Hopefully you guys can hear me, and I see that you can see me, but hopefully you can hear me. So let me know if you can't hear me. Um I'm going to go back and acknowledge some of you. Let me go back to the top. Hello, Cherry's Jubilee. Welcome to the chat tonight. Glad to see you. Cherry's Jubilee says, I needed this 2 months ago. I believe you. A lot of you a lot of you requested this video. So this is a viewer requested video coming up tomorrow and Sunday. I'm sorry, coming on Sunday. Tomorrow's Saturday. Coming Sunday at 2:30 p.m. Eastern time. And then a lot of you had requested this live chat. So I believe you, Cherry's Jubilee, that you needed this 2 months ago. And then Courtney Fraser, hello, welcome to the chat, was just telling me about her bad day today. And I was just confirming that my week has been like a horror movie too. So don't feel bad. Let me just say, my week has been nothing but busy. I took on a client that, or who I thought was going to be a client. I took on someone who is a pathological liar, and it couldn't be any more well timed, right? Because I'm talking about this tonight. And I will bring this person up because they're not my client. They're not seeing me for treatment, so I can bring them up. But I had a client, somebody talk with me this week who's a pathological liar. Then I also had a client who had someone misconstrue entirely what she meant. Uh, because he is a narcissist. And so my whole week has been chaos, not to mention my own personal life. So, Courtney Fraser, don't feel bad, okay? You're not alone. I see Deb, hello. How are you? I hope you're doing okay. Welcome to the chat. I see Rabbit Bill, hello. Welcome to the chat. I haven't seen you in so long, so it's good to see you in the chat box. MJ says, I just joined. I'm UK midnight. Whoa. Welcome to the chat, MJ. I hope you're doing well. I totally love the UK. I've been there several times in the past, and I was ready to revoke my citizenship to come to the UK, to be very honest. I thought this place is fantastic. So, welcome to the chat. I'm glad you're here, even though it's midnight over there. I'm probably gonna mess this up. It's Ses Homerus? Side eye? Okay, forgive me if I mispronounce that. You'll learn I can never pronounce screen names as you continue to watch my live chats. Welcome to the chat. Glad to have you as well. Um, Oh, thank you so much. Deb says, I'm so sorry, Tamara, that you've had a nasty week. Yeah, thank you so much. Oh, it's so hard. You know those weeks that you have where all you want to do is cry because like nothing you do is right. And you want to go home. Like, okay, I'm done. I'm done dealing with human beings. Time out. So thank you, Deb. I appreciate your compassion. Okay, and I feel like I missed somebody. I don't think I did. Okay. Yes, I did. Marthea Wells, hello. Welcome to the chat. And yes, you caught me live. I'm so glad you're here. And you're welcome, MJ. You're welcome. You're welcome. All right, so let's jump into this, okay, guys? You're probably well aware of pathological liars. They, ooh, they are some of the most difficult individuals, okay? um you know so if I put my 14 years of experience to the side as being a clinician and just talk to you as a human being, somebody that has zero clinical experience, um I will tell you that I would run uh faster than you could believe if I encountered a pathological liar, because you can never identify the truth. You can't believe what they say. You can't believe even their apologies to you when they've done something wrong. Everything they say comes out wrong. And that's because there's something going on here. And I'm going to get into that tonight, guys. But if I pull my clinical hat, my 14 years of experience back into the equation, I can tell you that these individuals are pretty messed up. They have a hard time connecting with people, living appropriately, respecting other people's boundaries. They don't have the ability to feel guilty or remorseful. Pathological liars are pretty much born liars, and that's why they are pathological. It's a problem. If you think of the word pathology, that means sickness. And so pathological is saying to you in that word, pathological liar, that they are sick. Something is wrong with them. And so, they have this block up, where they can't communicate with humans in a genuine and honest fashion. It's just not in them. Now, if we contrast a pathological liar who lies just because they have a mouth, if we contrast them with a compulsive liar, things get a little bit complicated, right? Because we start blending those two, pathological liars and compulsive liars. And let me just clarify briefly that a compulsive liar is an individual who lies on impulse. They may feel remorse later, in the moment. If you have a family member like this, a parent, a friend, a husband, a wife, a cousin, whatever, in the moment it comes out in the mouth, right? Whatever that lie is going to be. And then they continue on to say things that are not truthful and honest and genuine. Now, they may walk away from you later, or separate from you for a little bit, and then they start processing what they've said. And these are the kind of individuals, compulsive liars are the kind of individuals that will sit with themselves and say, why did I say that? Why did I even, like, I knew better, right? That's a compulsive liar. It comes out impulsively. Later, they go back and say, this was such a mistake, you know? And the compulsive liar may actually feel remorseful. They may really cause a lot of damage, but thankfully and possibly they have remorse and guilt. And so, they're kind of redeemable. You know what I mean? I rather work as a therapist, as a psychotherapist, I rather work with a compulsive liar than a pathological liar, because a pathological liar, again, is pretty ill in terms of communicating with people. But a compulsive liar, again, they're impulsive. And so we can work on that. We can kind of help you pump the brakes a little bit and process what you're doing wrong. Now, I'm going to throw another coin into the pond here, and that's a natural liar. And a natural liar is so natural that you can't tell what's truth, what's fiction. You kind of want to think of a natural liar as they know how to blend reality with fiction so much that it blends nicely. You know what I mean? It blends almost like for lack of a better analogy, it almost blends like paint. If you blend two colors of paint together, it can come out to be, some kind of really cool color that you can actually put on the walls because it looks pretty cool. That's kind of like that's kind of like a that's kind of like a natural liar. They know how to blend reality with fiction so well you don't even detect they're lying. And they may, add some personality and some pizzazz and some humor and some truth and some fiction, and before you know, you've got this liar talking to you, and you're like, wait a minute, something feels off with that statement, something feels off with that comment, but we'll go with it because they don't typically lie. And with a natural liar, there may be some white lies in there, right? It may be really small. Like, I'm sorry, I can't attend my appointment today because my mom told me she needs me to take her somewhere. That's not true. Maybe you just want to stay in bed today. Or you call off from work, for example, and you say, you know what, I'm sick. I can't get into work. Hang up the phone and you're like, okay, let's go ahead to the park. Let's go walk the dogs. You know what I mean? So that's a natural liar. They sound so real that it's hard to tell what's truth, what's fiction. And those kind of natural lies tend to be white lies. Okay? So there you have it. Pathological liar, compulsive liar, natural liar. I see a lot of you talking, so let me get to the chat box, okay? Hi, fairy girl with the dabs. Hello, I love that. I still love that. Let me say something, fairy girl, about that, by the way. So I see adults for psychotherapy who are dealing with trauma, grief, loss, life transitions, but I specialize in treating children, teens, and families. So my little kids who are under the age of 10 years old, the other day, I the kid, one of my 10-year-old kids said to me, Miss Tamara, can you dance? And I'm like, yes, I can, excuse me. And I'm like, was that supposed to offend me or something? And so, the 10-year-old laughed. He's like, oh my God. So, I'm like, do you think I'm old or something? I can't dance. And he's like, well, show me a dance move. I said, I can do the dab. And he's like, oh my God. He's like, oh my God, Miss Tamara, we don't do that anymore. So, Fairy Girl, I love the dab. I think it's cute. But I was punished by one of my kiddos at the office. He's like, we don't do that anymore. You're old. All right, I'm going to keep going, guys. Nay, hello. Welcome to the chat. Glad to have you tonight. Dragon Man Sassin, hello. Happy Friday to you, too. Um, Chat, hello. Welcome to the chat. So glad to have you. Melissa Martinez, hello. Welcome. Glad to have you tonight as well. I'm going to keep moving. Well, let's see. Bill Rabbit or Rabbit Bill? That's a great question. Let me answer it. Rabbit Bill says, how are you to spot them? What do you look for in them? I'm sorry about that. So he says, how do you spot them and what do you look for in them? Pathological liars, that's a fantastic question, Bill. Pathological liars are really difficult to spot. The only time you're going to spot a pathological liar, a compulsive liar, and a natural liar, either one of those, is when they actually engage in the act of lying, because and I'm going to get into this in a little bit. Most pathological liars are not even diagnosed with anything clinically. Pathological lying tends to be a symptom, but it's a symptom of something much bigger, and I'll get into that in a little bit. But let me just be honest with you, all of you who are on my live chat tonight, that pathological lying, the research, the clinical data, we are so far behind. The most recent research on pathological lying tends to be dated between 2020 and 2022. Like, I don't know any research studies of 2023 that can give us some insight about pathological lying. We are so behind in that area. So, I can't even say, here's a journal where I read about pathological liars. We don't have that for 2023. So the research is lacking. The other piece of the puzzle, Bill, is spotting a pathological liar is going to take some time, because a lot of them only lie when they get comfortable. They really do kind of hold back their lies until they get to know you, or until you're committed to them, or until you anger them or something like that. It's really difficult to spot them, and I'm going to talk a little bit more about them tonight, so you'll get a little bit of clues on how to spot them, Bill, and for the rest of you. Okay, let me keep going. Kat says, Deb, I understand. When I lived with my family, it was horrible until I left. Sadly, I got with a few narcs in a relationship and it started back again. Now I am free. So they're talking about, this unhealthy relationship pattern. And let me just highlight too, I'm going to piggyback on that, Kat and Deb. Let me just highlight that a lot of pathological liars do engage in unhealthy relationships with other people, unhealthy romantic relationships, marriages, friendships, co-worker, relationships, because a lot of the time they don't have the social skills needed to be healthy. And that's why they lie in the first place. They are not healthy. So a lot of pathological liars tend to be very dysfunctional when it comes to relationships. Kat says, when you catch them, they look so foolish. Yeah, they do. If you're dealing with a pathological liar, however, keep in mind that most pathological liars have lied before, and they've lied across domains. So here's an example of that. They have maybe, let's say, a childhood history of telling lies. They have an adolescent history of telling lies. And now they're an adult and they're telling more lies, which tends to graduate. Right? So they graduate from childhood lies to adolescent lies to adult lies. But then on top of that, hold on, guys. I hit the wrong button. What the heck did I just do? Okay, I got it. Sorry, guys. But then on top of their graduated lies, pathological liars don't tend to look foolish, because they believe, and they often try to practice this technique, that if they change their face and their body language, that they can actually get over on you. Because they know that we often look for signs of lying. We look for eye contact. We look for darting eyes. right? We look for crossed arms or tensed shoulders. There's always something that we look for to try to identify a liar. A pathological liar is a little bit smarter than us, and whoops, I dropped something. They will know how to adjust their body language, their facial expressions, their eye contact, just so that you will believe their lie. Now, the liars that look foolish are probably the compulsive liars and the natural liars. So that's the way I like to break that up. That's a good point, Kat. One Love, hello, welcome to the chat. Glad to have you as well. Says, good day all. Finally going to get some understanding of why. I hope so. Let me know at the end if I've covered all bases. I'm really going to try. I also have a video that's recorded. It's already posted on my channel, ready to go for Sunday at 2:30. And I'm going to break this down a little bit more, okay? So stay tuned for that. Chill often. Hello, stranger. I haven't seen you in so long. Welcome back and welcome to the chat. Thank you. And I'm glad you did catch a live as well. Glad to see you. Marthea Wells says, are these lying responses learned? This is a fantastic question. So I was going to get into this later, but let me just jump into it now. Our current research, which is behind, says that there's a variety of factors that creates a liar, a pathological liar. One is genes, the other is environment. We also have a potential personality disorder, and we also have modeling. So maybe a parent was a liar and modeled it. Maybe a friend to an individual who is a liar had the friend was a liar. And so now, you have a pathological liar on your hands, right? It is learned, but it's also genetic and it's also environmental. So we learn our behaviors right in our environment, as you know. And so pathological lying has an environmental component. So it could be learned. But then it is also genetic. There are some people who are born narcissists, they're born sociopaths, they're born histrionic personality disorder. They have those characteristics, and those three groups tend to lie. So there's the genetic component. So it gets pretty complicated trying to figure out, is this a gene thing? Is this an environment thing? Is this a learned response? Is this self-esteem? Like, we are so behind, guys, in trying to figure this out, Imagine, and I'm sure most of you have this, imagine having a family member who's a pathological liar, and then they bring a child into the world and the child becomes a liar. Now you've got two liars in the family. And so, it gets complicated, especially when you look at the genes. All right, let me keep going. Courtney Fraser says, I use lying as a defense mechanism to protect others, or if I know others won't like the truth. Well, let me categorize this, Courtney Fraser. You are, to me, you have hit the nail on the head there, and you are 100% on point, because there are some lies that are okay, and we would consider those white lies, and we would consider those lies protective lies or defense mechanisms that are healthy, right? Sometimes we do have to lie. I remember years ago when I started counseling young adults in a hospital, a psychiatric hospital. I had a client who I had to lie to because she was so psychotic and so unhealthy and very delusional that I couldn't, how do I want to put this? I couldn't connect with her in a 100% genuine fashion because if I did, she would go against me because she would know that I don't believe her delusion. So a delusion, for those of you who aren't aware, a delusion is a false belief that's held to be true. And she had a false belief. She thought I was a celebrity, and she thought her husband was against her. She thought the FBI was against her. And then she thought that I was supposed to marry some man from history. Don't ask me what, it was confusing, okay? And so each time I would have a session with her, I couldn't be honest. I couldn't be like, no, I'm single. I just got out of graduate school. I'm going home tonight and I'm free. And, I couldn't be honest with her. I had to be what she thought I was in that moment. And I did that because I needed to gain her trust. And that sounds so twisted, but I needed to kind of lie to gain her trust so I could get in and help her with her delusional beliefs. And she got better over time. So some lies are necessary. I'm glad you brought that up, Courtney Frazier. Thank you so much, Justice Tech Pros. That's so sweet of you. I really appreciate your kindness and your donation. I always say I appreciate you. Justice Tech Pros says, fantastic channel. Thank you for the informative topics and sharing your knowledge. Yes, you're welcome. And thank you once again. Okay, let me go back because I don't want to. That's so sweet. Thank you. I don't wanna lose where you guys are. Hold on. Daima, hello. Welcome to the chat. So glad to see you. Says, hello everyone. Was one leg in the bed when I saw this notification. Okay. That is hilarious. Anytime I go live on YouTube, I'm like, I hope I'm not going live too late. So that is so cute, Daima. I love that. Welcome. Fairy Girl says, what's your other leg up to, Daima? Oh, that's so funny. Muhammad, hello. Welcome to the chat. Glad to see you as well. Or Rapid Bill says, from what I understand, they don't stay on the subject. If you try to get them to explain something. Short answer, and changing the subject quickly on you. Yes, no. Well, so the liar that you're referring to, the individual who changes the subject quickly because they're lying, or the individual who avoids the subject, is usually a compulsive liar. Because again, you got to remember, a compulsive liar is impulsive. So they know logically what they're doing is not right. They also know that they're getting ready to lie, and it comes out, but they can't grab it and stop it before it's out. You know what I mean? Somebody who engages in natural lies also may change the subject, or they don't want you to ask questions, things like that, because they know they're lying. So a natural liar, a compulsive liar, they are both individuals who will dart their eyes all around the room when you're trying to get the truth out of them, or they will try to cover things up. You know, a pathological liar could care less about what you believe. Sometimes the pathological liar will sit very narcissistically. I just made up my own word there. They will sit very arrogantly, for lack of a better word, and just kind of let you figure out what the truth is, you know? So that's a good point, Bill. Thank you for that. Yes, you're welcome, Kat. Absolutely. You're welcome. All right, so let's get back into this. Yes, you're welcome, One Love. Absolutely, you're welcome. Okay, let me jump back into this, okay, guys? So we left off, I think, at just really teasing apart who pathological liars are. Now, you may be wondering, what kind of disorders could somebody that I know who lies a lot, what kind of disorder could they have? Research suggests that there's three main disorders, and this may shock you. One is histrionic personality disorder. Histrionic personality disorder is really, it's a cluster B diagnosis, meaning cluster B, and I have it here tonight, cluster B in my DSM, the Diagnostic and Statistical Manual. Look at this book, guys. This is the clinical manual that the United States uses. I don't believe any other state, the United States uses. I don't believe, or I can't recall if any other country uses it. I think we're the only country who uses the DSM. But in this manual, cluster B is a category. It's like an umbrella category. And under that umbrella category is all the emotional, dramatic, really reactive and impulsive diagnoses, such as borderline personality, very emotional, high intense. Narcissism is in that cluster B umbrella category. We also have antisocial personality disorder in that cluster B umbrella category. But what I'm talking about here is histrionic, and that is also in that umbrella cluster B category. Histrionic personality is this. It's very dramatic. There's a lot of dramatics, a lot of crying, a lot of screaming with these kind of individuals, a lot of lying, a lot of blowing up and exaggerating and catastrophizing things. Everything is this big to a person with histrionic personality disorder. This is the kind of individual that you would walk into a grocery store and see cussing out the clerk over there, slamming things, looking at everyone saying, did you see what he did to me? Did you see what he did to me? running down the aisle and screaming. Maybe they threw a shoe, right? Or something like that. I've been in situations where I'm like, oh God, why did I come into this store tonight? Because a person with histrionic personality disorder, everything is this big to them, and they react like that too. So those kind of individuals engage in pathological lying. They also can be compulsive liars. They're just impulsive and emotional and reactive, and that's where the lies come from. Research also suggests that narcissists are pathological liars and people who are identified to be sociopaths. So those are the three categories. Now, borderline personality disorder doesn't seem to be the category of pathological lying. You may get some natural lies with borderline personality, and you may get some compulsive lies, but for the most part, that's not a diagnosis where lying occurs. Again, it tends to be the histrionic, narcissistic, and the sociopath. Also, too, let me mention Munchausen syndrome and Munchausen syndrome, by proxy, are two diagnoses that also includes pathological lying. Both of those legal those legal titles, because it's in the DSM, in the diagnostic book. You can diagnose it, but it's more of a legal concept, because it's really not a mental health condition. But individuals who makes somebody else sick, like they're the caregiver of their mother and they're making their mother sick, or they're making themselves sick so they can go to the hospital and get love and affection and attention. This kind of problem, I'll call it, often includes pathological lying. Factitious disorder is another one where, somebody kind of injures themselves, or they put on a cast and act like they broke their arm because they want the attention. Maybe they want money. Maybe they want to start a lawsuit. So they limp around or they walk on a cane and act like they're hurt. Pathological lying happens in that diagnosis as well. Okay. I think we covered just about everything. I want to go back to the chat box though. Give me 1 second, guys. Whoops. And make sure that you guys aren't saying anything that I can kind of capitalize on. I'm gonna before we wrap up in a little bit, I'm going to show you like where pathological lying starts and where it ends. So give me a couple minutes, guys. I'm gonna check the chat box. And make sure that I'm answering all your questions. Kat, oh geez, what am I doing? Kat says, compulsive liars are lazy individuals, in my opinion. Looking back, I noticed working is a phobia for them. They are the one living off you. Well, let me just say, compulsive liars are individuals who are impulsive, Kat. They may have a diagnosis like dependent personality disorder. They lean on people. They're dependent. And of course you have to lie when you have a dependent personality, because you have to try to hold on to people with those lies. You have to try to defend maybe while you are lazy. You have to try to cover things up and make it look like you really are very dependent, right? So some of the research does suggest that pathological lying can happen in those who have a dependency on somebody else. Codependency, is another thing that I should have brought up earlier. You can be a pathological liar and be codependent on somebody else. I mean, it gets even 10 times worse if that other person that you're codependent on is also a liar. So then you've got two people in a relationship who are liars, and it gets complicated. The client that I thought I was going to take on, that I referred, there was a lot of codependency in the relationship between this person and their spouse. And the pathological lies were so extensive that I sat there and I was just like this at one point in the session. And I'm like, this is not going to work. You can't do psychotherapy with a pathological liar unless they are willing to identify the problem, work on the problem, try to practice being honest and genuine, and go from there. But like, therapy is really difficult with these people because everything that comes out of their mouth just about is a lie. That is so tiring and so exhausting. Yeah. Yeah. One Love says, sad to say, but some liars sound believable. If you don't know them personally, yes, they do. Yes, they do. I can attest to that. You know, I've had liars in my life personally. I've also had pathological liars in my life professionally, more than I care to even admit. And yeah, some of them are very believable. And I have been deceived in the past from a pathological liar. I thought I understood, this person, and I did not. And so it took personal and professional experience with this person to identify that they lie every time their lips are moving, and there were some things that I did believe that there were children in the relationship, with her husband. She didn't have any biological children, but she told me she did. I did believe that she was an international speaker and, somebody who was a wonderful nurse who was promoted at work. That was a lie. She actually worked at Lowe's and was never promoted in her entire life. So like, unpacking the lies of a pathological liar can be very traumatic. It can be harmful. But you're right, One Love. Sometimes they're believable and you can fall for it. Let me just say, I don't want you guys to feel, if you have ever felt, what's the word, shamed or shameful, or start to kind of internalize your emotions about the pathological liar, and kind of feel like, how could I let that person just trick me like that, right? You may even say something to yourself. Your internal dialogue may be, why didn't I see that sooner? Keep in mind that pathological liars are liars for a reason. They benefit. There's something about them, and they benefit. There's something about them that causes people to believe them. So it's not your incompetence, it's not your inadequacy, it's their skill. And that's the problem. They're very, very skilled. Hello, Charlie. Welcome to the chat. So glad to see you. Teddy Teddy Burr, I'm going to say, hopefully I said that right. Hello, welcome to the chat as well. Says, the first rules in clinical psychiatry is to never ever enter in a delusional pattern or play in their madness. You should have found another way. There is many. Yeah, there is many. But, let me just say, Teddy Bear, everybody's approach is different, and so no, you don't want to partake in the delusion, but sometimes in order to get really close to that person and build that clinical rapport, you have to kind of stay behind this wall, right, until you get to know the patient or the client. Then you can come out and say, okay, so let me share this with you, or here's what's going on, right? So it really just, I think that approach of not participating in the delusion, but you are kind of tiptoeing. You're walking very carefully that thin line between truth and their delusion, right? So it can be really tricky. It can. All right, let me keep going. Deb says, I got really good at lying because it was self-protection or self-protective. If I wasn't good at it, I would have suffered more abuse. Yeah, I understand. And Deb, you point out something essential, that sometimes lying is protective, right? You have to protect yourself. Think of the horror movies and the thrillers that you may be seeing, where the person that is coming after you to kill you is a murderer, they're a serial killer, and the serial killer is right there in front of the person, and you can't necessarily go against them, right? Because if you go against them, they may kill you. So what do you have to do? Well, you may have to play along. Have you seen those movies, guys, where, the serial killer is on his way to kill the person, and he said, let's say, for example, he says something like, you never really loved me, how could you do this to me? Are you going to say, yeah, right, you're right, I never loved you, I think you're creepy? No, you're not going to say that, right? You're going to say, you're right, I do have feelings for you. I do love you. And I want to be able to help you, right? You're going to play into that just a little bit so that you can be free. And so it is protective, Deb. It's wise sometimes to play along with somebody who's unstable or disturbed until you can break free, or as a protective mechanism. So I'm really, really glad that you brought that up, because that's essential here. And I think it really goes back to Teddy Burr's statement as well, that we don't want to play along with the delusion. Sometimes you kind of have to, right? It's life or death sometime. Yes, you're welcome, Rabbit Bill. You're welcome. Ash Nicole says, what are your thoughts on gang stalking? Well, I mean, this video is not about gang stalking, but I'll go ahead and answer this because sometimes pathological liars do gang stalk, and I won't go too much into this. But stalking is horrible. There's often a very negative dynamic between all the individuals in the group that's stalking. For example, there tends to be what we call a collective disturbance, meaning here's a group of people who are all disturbed. There may be a leader, right? But this whole group is doing something to me because they're all disturbed. My thoughts on it is just simply that it is a collective disturbance. It's unhealthy and it's unstable. You may also find pathological lying within that collective disturbance, right? They may all be liars in that group that's stalking you. So I'll leave it at that. Oh, thanks, Deb. I'm not going to read that out loud, but I really appreciate you trying to make the comment and the conversation friendly. I appreciate you for that. Sarah S says hi. It is used here in France. Oh, really? I didn't know that. First of all, welcome to the chat, Sarah. I hope I'm saying that right. I did know the DSM was used in France. Thank you so much for pointing that out. Thank you. All right, let me keep going, guys. Oh my lord, did I hit the wrong button? I really hope not. Okay. Um, One Love, I'm going to read this. One Love, I love this comment. Says, my hat goes out to professional counselors. You, Tam, I couldn't do it at all. Well, thank you, One Love. Let me tell you, my brothers, I'm a middle child. I'm the only girl. I don't know how I survived. I really don't. I should have probably been in the hospital dealing with two brothers. Like, woo. But let me tell you, my older brother, who's in his late 40s, said to me maybe last year, he's like, I don't know how you do it, Tam. My brothers actually call me Tam. He's like, I don't know how you do it. He's like, I couldn't do this work. I really couldn't. Like, I have no control over the decisions people make. I have no control over nothing. He's like, I would rather just work at the post office, get a paycheck and go home, you know? I can definitely agree with that. I think it has to be a calling, it has to be a passion, it has to be a desire. Because let me tell you, One Love, this is tiring work, you know. So you have to really have a heart for this, or you're gonna drop out. Pete, don't repeat. I hope I said that right. Hello, welcome to the chat. Says, my ex-wife told me she was going for billing and coding career every Tuesday, Thursday night for 2 years and Saturday study. She never went once. She already had a business degree. I took care of sons. Wow. So I'm guessing you're thinking that what? She was a pathological liar, compulsive liar. Some people can live that double life, you know? Have you seen those really scary date night? Dateline, for those of you who are 30 and up like me, Dateline on NBC or something like that, where, you know, there used to be these like case studies and these stories told about people who live double lives. You know, they tell their spouse one thing over here and then tell somebody else one thing over there, and then there you go, they have two different lives. It's very destabilizing when you realize, wait a minute, I've been lied to all this time. Yeah, I see that now that I scroll down. Pete, don't repeat, says, she had a double life in my position in life. My family was a part of it. My mom and dad, who were divorced, loved her. Oh my God, yes. Yeah, right? Divorce in that scenario is like essential, right? Because somebody's been lying to you for Dateline. Yeah, Eros remembers Dateline. I'm so glad I'm not the only one. But divorce is necessary in those cases, right? Because there's a level of trust that has been reduced. There's a level of trust that has just been minimized. So divorce, that would be my recommendation. Just get a divorce. Annabis, the opener of Ways says hello, Tamara, and hello to the chat. Hello, welcome. Glad to see you always. Yes, Cherry's Jubilee. She says I'm here. Hello, welcome to the chat. Okay. Yeah, I agree with that, Deb. She's talking to Pete. Okay, Let me show you when this starts, when it peaks, when it ends, and then we can wrap up, okay, guys? Because literally, I could talk to you all night. I love your energy. Okay. Uh-oh. So let me show you this. So I'm going to do a bell curve, okay, like this. This is the bell curve. And pathological line starts in childhood. So I'm going to say between the ages of 5 and 10. Okay, so between the ages of 5 and 10, we have line that begins. That kind of line may be white lies. My sister pinched me. Yes, I ate my green vegetables, mom. Yes, I flushed the toilet. You know, no, I didn't paint on the walls when I was told not to. No, that marker is not on the wall, mom, right? White lies from kids. So, usually between the ages of 5 and 10. Now, this is what research suggests, and I see it too in my practice. Now, lying tends to peak in adolescence, and that's usually between the ages of 13 and 18. Just to kind of give you a visual, because I learn best with visuals. So here we are. It peaks in adolescence. If lying behavior starts between 5 and 10, you've got all that time, all those years, all that time, to learn the child's behavior, to hear all the lies that they've ever told. If the lies continue to be repeated through the years of age 5 to 10, you're likely going to get a lying adolescent, and then that's when you can say, okay, here's a child who's going to become a liar in their adolescence. So between the ages of 13 and 18. Now, let's say between 21 and up, you may see some of the lying right on its way down. And research suggests that lying decreases with age. So this is how you can conceptualize this. So childhood peaks at adolescence, maybe steady around 21, right? And maybe by 30s, 40s, 50s, it goes down. Now, why does research say that pathological lying, compulsive lying goes down in adulthood? Most likely because of the consequences. No adult wants to be caught in a lie, because that lie may cost them their job, their marriage, their relationships, all of that. So lying tends to go down in adulthood. But you may be thinking, well, what about those adults who still lie? Well, research doesn't include them. They're an exception to the rule. But again, our current slim research says it occurs in childhood, peaks at adolescence, maybe steady in young adulthood, and then by 26 and up, the lying behavior may decrease. So, all right, let me keep going, guys. Let's do the chat, and then let's wrap up. Okay, thank you so much, Pete. Don't repeat, and you're welcome. Thank you. I'm always grateful for your contributions. You guys don't ever have to do that, so whenever you do, I'm grateful. So thank you, Pete. Don't repeat. I appreciate you. Okay, I'm gonna say this wrong. Is it Baby Buddha Luna? I think I got one right for the first time. My mother lied all the time, she says, but I wasn't allowed to say the word lie, only telling a story. Yeah, because telling a story makes it a white lie, right? If you're telling lies that you know are not right, you want it to be a white lie because it feels better. So might as well call it telling stories. It's easier. Excuse me. It's a lot easier. Sorry, guys. Okay, the only question I have, okay, let me read the screen name. So Kat says, the only question I have, why can't a parent control a child that lies by placing services in place? I dated one over 30s, and his father was listening to all his lies, shaking my head. Well, so let me go back to that. The only question I have is, why can't a parent control a child that lies by placing services in place? Okay, fantastic question. Here's the honest answer. We have absolutely no treatment protocol for treating a liar. I feel so bad saying that as a therapist, but we are so behind. We have no treatment protocol for treating a liar. We only have a treatment plan, a treatment protocol, a treatment program set for people who have a certain diagnosis. Like, narcissistic personality, sociopaths, antisocial personality disorder, bipolar disorder, depression. We even have a treatment protocol for PTSD. The list just goes on: ADHD, ODD. But we have absolutely no treatment protocol, no treatment program for pathological, compulsive, or natural lying. We just don't. We're lacking that, and that's where we're lacking. Now, there is a researcher, though, who, and I can't remember his name, he's through Yale University. I'll try to post this information in the description box for you. He wants pathological lying to become a diagnosis. So think of it this way: pathological lying is the umbrella, and under that umbrella is a bunch of subtypes, right? Like natural liar, compulsive liar, emotional liar, angry liar, manipulative liar. Like, he's onto something. He wants that diagnosis written in this manual over here, the DSM. In case you guys just signed on, I talked about this. He wants this professor from Yale. I'll put his information in the description box. He wants a diagnosis with all of these subtypes underneath, because we need a way to treat pathological compulsive liars, and we don't have that. So that's why dad couldn't jump in and put services in place, because there's nothing to treat, as sad as that is. Okay. Oh, thank you, One Love. Oh, you're so sweet. I appreciate you so much. Thank you for that. I see somebody else too. Wait, hold on. I don't want to overlook anybody who's being really, really sweet tonight. Did I overlook someone? I don't think so. No. Okay. I'm so scared to press anything. I'm so scared that I'm going to mess things up. Thank you so much, One Love. That's so sweet. Thank you. Okay, let me keep answering questions, and then we're going to sign off, guys. Okay. Okay, so Ash Nicole, can you clarify that question for me? She says, what do you think of targeted individuals being classified as labeled as a liar? Can you clarify that for me? Because then I can directly answer that question. Dorian D. Michael, that's so sweet of you. Thank you for your contribution as well. That's so kind. I'm always appreciative of that. Thank you. Let's see. Hi, William Buddy. Welcome to the chat. Glad to see you. Says, how do you heal from being gang stalked? Oh, that's such a great question. I'm not going to even open that can of worms, because we're going to be on here for a whole other hour. So I will definitely talk about that in my next 3 live chats, because I'm going to bring up family stalking. So stick around for that, guys. Yes, you're welcome, Kat. Kat says, this was great. Thank you, Tamara. You're welcome. You're welcome. And thank you for your awesome comments and questions. Oh, I get you. Okay, so let me go back, Ash. Hold on. Nicole says, what do you think about targeted individuals? So, individuals who are being gang stalked, what do you think of them as being labeled as a liar? Well, that's a difficult one, right? Because anytime stalking enters into the equation, it's really difficult for law enforcement, psychotherapists, psychologists, doctors, the list goes on, to believe the person who's the victim of the stalking, right? So they could be labeled a liar until there's proof. So my thoughts on that is that we need a better protocol for understanding the victim, the person who is being stalked, right? So that you won't be labeled falsely as a liar. Does that make sense? So yeah, that's my thoughts on that for right now, just to cut it short. Hi, Lisa. Welcome to the chat. Says, what is the root cause? Well, the root cause, again, is genes and environment. Modeling, right? Maybe a parent modeled lying behavior. Maybe, the child's friends modeled lying behavior. And also some kind of personality disorder, like narcissistic personality and antisocial personality. Histrionic personality, again, that really exaggerated emotional response to life. Those individuals also engage in pathological lying. So the root cause is varied. It's varied. That's the best way for me to put that. Colibri Flyer says, I recently cut off my relationship with my sisters, who I suspect are covert narcs. I've been observing their behavioral patterns for years. Yeah, sometimes that's all you need, right? Is those behavioral patterns happening over a long period of time. And that makes it a lot easier to say adios amigos, right? I don't want to deal with this. Maybe you're too tired, you're too old, you're too whatever, and it's not fair to you, right? So good for you. All right, guys, you guys are wonderful, and I say this every live chat, but it truly is what I believe. Thank you so much for all your wonderful contributions tonight. I appreciate your support. I appreciate you. I will see you hopefully on Sunday. I'm going to break this down just a little bit more for you before we jump to the next topic. And if you have further questions, post them in the comments box for me there as well. So have a wonderful weekend, guys. I'll see you soon, okay? Bye-bye.